And we're going to finish off this week, of course, chatting with Dr. Ross Goldberg this morning about some of these numbers and the data that is coming to us here on this Friday. Dr. Ross Goldberg, thank you so much for your time on this Friday. We appreciate it. And I wanted to ask you first, if we could. So last week we finished around 7% in terms of percent positivity. This week finishing up about 6% thus far. What are your thoughts on that? And, should we be pleased? Obviously, we've seen some of these numbers stabilize around that area.
Yeah, well, first, good morning, as always. These are all encouraging signs, right? We're moving in the right direction. We're getting shots into people's arms. Our numbers are going down. Our case numbers are going down. These are all good signs. But again, it's people, I think, are getting annoyed with the medical community saying we want to be cautiously optimistic, but we don't want to do a victory lap just yet. We still have a ways to go, and we still need to do the right mitigation measures to keep on going in the right direction. But these are all really good things that are happening right now.
So you're with Valleywise, and I've heard with some of the hospitals in and around the Metro Phoenix area that some of their COVID units have closed down because they haven't really needed them, and they've been, rerouted to help with other types of patients. Your thoughts on that? Is that happening at Valleywise, and do we need to be cautiously optimistic about possibly having to reopen those with variants kind of still out there?
Yeah, well, we are consolidating our units. So again, kind of like having been through a couple surges now, we kind of stack up when we need to and increase the capacity for COVID patients, then decrease to handle with the rest of our patients. We're on that downward slide right now where we don't need as many COVID beds, which is great. We're hoping to keep that way. But like you said, there are variants out there. We still haven't gotten everyone vaccinated. We're going to be a few months away for that, obviously. So we still need to really make sure we have the ability to increase our capacity if needed. The hope is we won't need to if people keep on wearing their masks and doing the physical distancing to prevent the spread of the virus.
So let's talk about the variants, if we can, for a brief moment. The variants, some states, have been maybe a couple of them around the country, not here in Arizona, fortunately, that have seen, COVID increase, COVID-19 testing, of course, coming back with a higher positivity rate than what we're seeing here. Do you think that's due to some of the variants kind of floating around, or is that still, under study right now?
I think it's a combination of things, but obviously we saw the variants have spikes in other part of the world. So it's not a surprise if as these variants take hold, they do transmit easier, they are more aggressive and spread. So it is not a surprise that you start seeing these pockets appear, which is why we really have to be vigilant and stay on top of this and don't let the variants get ahead of the vaccinations. That's going to be the trick right now. So everyone needs to stay aware and stay careful.
So let me ask you this. If you have the vaccine, and can you still get COVID? I think the answer may be yes. And do you still need to be tested if you're still showing some sort of symptom?
So I do know of a few people that have gotten COVID after even the second dose of the vaccine. It's not 100%. But again, it doesn't, we've seen with all the vaccines, they've created no hospitalizations and no deaths, but it doesn't prevent you from completely not getting the disease right now. If you do show symptoms, yes, you should be tested. And also remember is you may not be that sick from it. We still are not sure if you can't transmit it to others. The hope is you don't, but you want to know if you're positive or not because you don't want to be around people if you're nearly positive with COVID. So even though the window is a lot smaller if you're getting it, there's still a possibility. So you should still get tested if you have symptoms and still be careful.
I think of it kind of like the flu shot, and correct me if I'm wrong. If you receive the flu shot, you can still get the flu. You just don't get as sick as you could possibly get if you didn't have the flu shot. Is that correct?
The concept's similar. Obviously, we're talking about two different viruses, but yes, the concept's there is these vaccines are very effective at stopping coronavirus from being very, very severe. So no hospitalizations, no deaths. We're seeing a large reduction in severity of disease, but doesn't mean you can't get something. So it blunts it significantly and makes it much more manageable. The idea is to keep people out of the hospitals and not dying, obviously. So, but it doesn't 100% protect you, at least not right now.
So give me your thoughts on this. I was talking to a doctor just a few days ago, and we were talking to him specifically about the Johnson & Johnson vaccine and the fact that it's not as, it's what, 66%, I think is what it's at in terms of how well it can fight off COVID-19 compared to Pfizer and Moderna vaccines. But it's still better than nothing, they say. It's still better than what we see even with the flu vaccine in terms of how well it can fight it off. Is that correct?
So yeah, actually those numbers are a bit deceiving, and it's a little unfair to the Johnson & Johnson vaccine. You have to remember when each trial
Okay.
was done. Moderna and Pfizer was done much earlier and only done in the US, at least for our numbers. The Johnson & Johnson was in South Africa, Latin America, during the time when these variants
Okay.
existed. So they actually are seeing some pretty good results in areas where the variants occurred. And so, yes, there was about that 72% in the United States, 66% in South Africa. But then again, look at the severe disease. It goes up to
Mm.
85%, and it's 100% effective on hospitalizations and death. So if I had not gotten a
Okay.
vaccine yet and all I was available was Johnson & Johnson, I would get it, no problem.
So I'm getting the wrap, but I do have to ask you this because you just mentioned something I think that's very important. You mentioned the Johnson & Johnson and the fact that it was performed in other countries while those COVID-19 variants were ongoing. Do you believe then that the COVID-19 vaccine from Johnson & Johnson is better at protecting us from those variants than the other two?
I wouldn't say that. I haven't seen the data to prove that. I just know that it was tested during the variant time. I know that we've been comfortable with the Moderna and Pfizer vaccine with these variants also, which is why we're just advocating very hardly for everyone to get vaccinated with one of these vaccines to stay ahead of the variants.
Okay, Dr. Ross Goldberg with Valley Wise, thank you so much for your time this morning. We appreciate your insight. Have a great weekend and be well.
Thanks so much.